it's been all hands on deck, people helping all over eastern North Carolina, and ECU Health has stepped up as well. Let me welcome into the studio this morning my friend Brian Floyd. How are you?
I'm doing great, Henry. Thanks for having us here.
You guys are answering the call too.
Yeah, I mean, obviously, as the operating officer for ECU Health, I'm getting all these calls. What are we doing? How are we supporting the operations out there in the West? And, I find that because people don't necessarily see it, they don't know. And certainly we have a tremendous amount of experience dealing with hurricanes, although I will say even 99 probably doesn't come close to what's happening there right now. For reasons of the terrain and how that's affecting the speed of water moving and all of that. But I wanted our folks to know that we are engaged and how we're engaged. In fact, one of the things that on Sunday just made my day was we started to call and organize, okay, how are we going to help? And I found out that from one of my friends who's the CEO over the hospitals there, in the early hours of the morning, there was a purple ambulance bus that showed up there.
Oh, really?
And so while we were trying to get them organized to go, our teams had already hit the road and were on their way there.
Oh, wow, no kidding.
And so we were one of the first to respond, actually. We have a lot of supplies that the public doesn't know we have for disaster preparedness, and ECU Health is Eastern North Carolina's disaster preparedness corps. We have that responsibility with the government should there be, a disaster here in the East. And so we started sending supplies, organizing teams, and it was a good way for us to also just practice our response systems and help out. But our folks are just, they're great. And so as soon as this happened, as soon as this started happening, the disaster preparedness group started putting together, okay, what do we have and how can we help and how can we get there?
We've been through so much here in eastern North Carolina with hurricanes, tornadoes over the years. And they've come to our aid in the past.
Yes.
People from the western part of the state. I don't know what the exact details on that, but this is an opportunity for us to pay them back.
That's exactly right. And frankly, one of the things I love about ECU Health is we are filled with people who just care. And so there's a lot of politics in everything we do, and healthcare and everything. There's a lot of financial crisis issues and regulation and all that. But at the end of the day, we've organized people, and those people come the way they come. And here in the East, people have a lot of empathy, and they have love for other folks. And so as soon as something like this happens, our problem is how do we bridle our folks to make sure it's organized and that it's going to be useful and helpful and not something that actually makes it harder, for the folks there in the West. And that's one of the early issues when I spoke to folks. And you should know, every day, our teams are in contact with multiple times a day the national and state organized effort for relief in the West. So we're on calls with all the hospitals are in a call every day as a check-in to see how are we supporting the hospital systems and the emergency systems. And then there's also, of course, the calls that go with FEMA and the Department of Health and Human Services here at the state levels that are organizing disaster relief. And so we're staying very tight with them, and they're telling us, here's what we need, here's what we don't need, and here's how we would like to organize getting it there to maximize the use of National Guard resources and other things that are actually supporting this work. But the early issue was all of our folks wanted to go and just be of help. And, of course, that's dangerous. And at the time, they're trying to figure out how can they be sure of what is happening so they don't lose track of who's there and have more disasters occur. So we wanted to organize and make sure we were following that. The good news for us also is we have a lot of logistics people that this is what they do. They're prepared for this kind of work. And they train and they do scenario planning. They work with federal resources to be trained in this work. And so in this case, one of our resources that went on the ambulance bus actually is the one that has been coordinating patient transfers for that whole market with the government and took that logistics control to make sure we were adequately moving patients around. So ECU Health is deeply involved, is fully aware of what's going on, and is staying connected in that work. And we need to remember that this is not a short-term turnaround. This issue is going to take a long time for them to get to some form of stability. They'll be using field hospital resources. They'll be having makeshift clinics. You might remember in 99 when we set up all sorts of little physician office clinics that were tents and things like that. That's going to go on there for quite some time. And so the thing that we might need to be thinking about is, as we help, how do we help create a sustainable help to them over a longer period of time? Because this won't be a quick fix to anything that they're dealing with there.
What kind of are you hearing any stories back from your people on what they're seeing out there?
Yeah, it's devastating. There's just no other way to describe what's happening there. It is truly devastating. We all can identify with the water, the stagnant water, and how tall the water line can be in homes and completely covered homes. We've seen that. What we haven't seen, though, is how violent the water can be when it's running down a mountain like that.
Going down into the
And it
hollers,
all goes to these valleys where the cities are.
Right.
And so it is not only water, it's water that's running fast and then carrying debris and carrying all this dangerous material through and eroding roads and eroding the landscape there. And so it's unbelievable what it looks like for the folks that have been right there at the front line and seeing some of this. It's just tragic. And on the other hand, as things happen, what I love about people is people turn on that empathy for other folks quickly. And so the other thing, among the devastation, there's this contrast of the beauty of people who have forgotten all the other stuff that's going on in life. And they're not their things, they're not their jobs, they're not their wealth, they're just people. And people show up with love.
Word about their families.
That's right. And what they do is they jump in fully to say, how can I help? And so among the tragedy, there's the reality that people are showing up to help people in miraculous ways.
J.D. Vance mentioned in the debate last night the photograph of the two grandparents on top of the roof of a house with their grandchild, and they didn't make it. And that's going to be one of the images I think we remember from this. The other thing that kind of has struck me is I mentioned on the show yesterday, I was in a conference call Monday morning with the North Carolina Association of Broadcasters Board of Directors, and we were discussing what we can do and what we should do, and we were talking about maybe doing a statewide radiothon, telethon, and we had some of the emergency management people from Raleigh on the phone with us, and one of the people said something that just shook me to my core. He was like, "Guys, we want y'all to plan to do all that, but this is not the time for that. Y'all need to understand we're pulling bodies out this morning."
Yeah,
and so it's just a horrible tragedy.
One of the resources that's true, and one of the resources that they asked us for when they said, "Okay, if you can help us, this is what we actually need right now." Unfortunately, is morgue capability. Yeah. We actually sent the plans, the blueprints, when we developed a temporary morgue situation here at the outset of COVID. We built a stationary, temporary facility, and for 300 or 400 bodies, they needed that plan, and then asked, can we get people to help build temporary morgues for them? So we've actually sent mobile systems, and we have mobile morgue resources that, and so have many other health systems push that to them, because right now that is where they are. Is they're trying to take care of real tragedy. Yeah. They're not even focused heavily on the recovery side of this right now. It's, can they stop people from getting hurt? Can they just slow down the tragedy of what's there? There are facilities that you may not think about, like nursing homes, where you have people that are dependent on the resource there. How do we get them out of there and get them to safe conditions? And so that's the work that's happening still.
Yeah, they're having to evacuate. They've evacuated 2 prisons. Yeah. Over there. I've been getting press releases on that.
And it's not, think about it, it's not easy. So when we were called upon to help evacuate a facility, we have among the resources I mentioned that we have amassed over the years, we've been collecting through grants and other things, resources. We have millions of dollars of disaster resources, everything from mobile operating rooms to field hospitals that we can set up and things of that nature, and lots of supplies. One of those is a bus that it's been modified to be an ambulance for a large number of patients, and so it can hold a large number, 20-plus patients that are in an ambulance type of situation. We sent that, and we used that to evacuate a 23-person facility. But the problem is the roads are so bad and impassable that it takes an escort of National Guard resources just to move from one place to the next at this point.
Yeah, the infrastructure is going to be one of the first things that's got to be after they identify where everybody is and make sure everybody's safe. Those who have made it through, infrastructure is going to be unbelievable. I was talking to one of my close friends last night in Asheville. We were texting, and I asked him, "Have you got?" And he's on high ground. He lives up on, and he was not affected by the water, but by the rainwater and by the flooding. But his home is okay. But he indicated to me that the electricity came back on at his house yesterday, and I said, "Oh, that's good news." He said, "Yeah, the bad news is they're telling us it's going to be 8 weeks before we get running water." I mean. They're going to have to rebuild the infrastructure over there.
That's right. Yeah. And while that's happening, that is also happening in environments like hospitals there.
Yeah.
There were more than 20 hospitals deeply affected.
Yeah.
Not all of them had to be evacuated, and many of them have had power restored. Some have had water and power restored. There are some that still haven't.
Yeah.
And that's a very challenging thing because you have the injured patients you have to deal with in an environment where you don't have the resources as you need them.
Yeah.
For sure.
Well, thank you for updating us. We appreciate. We're so lucky to have ECU Health here. I'm so proud of what you guys you do for our communities, but now for the western part of the state as well. Thank you for. It doesn't shock me that you guys stepped in and started aiding folks in the western part of the state, but it's great to hear.
As I say, we are a service organization, and so when there's a need, our people really want to be there and help out. And I just want to take a moment and thank our people. The thousands of people asking, how can we help? What can we do? Just makes us proud of them. A natural response with the empathy that ECU Health people have. But thank you to our folks. Thank you to our doctors and our teams that have been asking, how